So I'm just comparing side to side. I want to see equal strength. Push into my hand here. Hold strong. Good. Now pull that thumb open for me, like this. The whole wrist and thumb. Try to rip it the opposite direction. Not that way, other way. Yeah. Hold that. Maintain, maintain, maintain. Hey everybody, this is Dr. Warren Kalkstein here at Kalkstein Chiropractic and Physical Therapy in Towson. And I'm with Vinny today, and I kind of want to give Vinny the spotlight, if you will, just kind of your experience and what you've been doing coming in. So I'll kind of give a quick background. Vinny's a firefighter, had an accident at work, had a full thickness bicep tear, went to Dr. Hobart,
yeah, at Towson Orthopedics,
who performed the surgery, and that was early December 8th.
December 6th.
December 6th.
Yep.
December 6th had a surgery, came in and really already had a relationship with our community here, had received care in the past, so he knew where he wanted to go to receive his physical therapy, he knew where he wanted to go to receive his care relative to the manual therapy that we provide. So kind of like big picture, when did you start coming here to this office?
I want to say probably like, I've been coming here for probably about going on 2 years now.
Okay.
Yeah, about 2 years, yeah, because I've been back in Baltimore for about 3. Yeah, so about 2 years, I want to say. Close to 2 years.
You commute down to Montgomery County, work for the fire department down there, and you've been in coming to see our office for 2 years. What brought you in originally?
So I did my research, asked around, looked at some reviews online, and this was the closest to my home, so I said, let's give it a try, and it's been great. Awesome. You guys have been awesome, man. Couldn't ask for more. Nice people, always just welcoming, and definitely the care has been A1 as well.
Awesome. You get to see, so with his current treatment, so he came in, initially my goal with him from a surgery from that perspective is to reestablish range of motion and get you comfortable. But you've utilized a lot of different services. So we do Shockwave for scar tissue management. That's something that's kind of unique to our office, I would say, in this area. But what's also unique is that you've got massage therapy upstairs, doing deep myofascial soft tissue work with you. So you get that angle of care, you've got the Shockwave, you got a group out there where you're doing your physical therapy and your different phases of your elbow and shoulder rehab. And then you're coming in here and you're getting the chiropractic side of things, the manual therapy side of things. So it's just a nice triage of care, especially for soft tissue management. So whenever I'm dealing with like tendon work like you had done, I feel like we have a lot of good resources for you. But yeah, I think you've got, what's Jess been like? You've been seeing her from a massage standpoint.
Jess is amazing. Hands down, the best massage I've ever had. And I'm not hyping or boasting or anything, but Jess has definitely been great. She definitely played a role in, the rehab, me getting back to where I need to be. Definitely I'll be doing a massage probably 2 to 3 times a month.
So
sure.
We're unique in that sense that you can come in and if they, relatively speaking, they work under our license, so we can get care for people coming in here, and in conjunction with the chiropractic care that we provide. So Jess is upstairs. They don't get enough spotlight. Art is upstairs. He doesn't get enough spotlight. He's been here forever and he's just amazing. And so I know that from a patient's report standpoint, it's not the first time someone has said that to me. Best massage I've ever had. So they're clinical, they're deep tissue, they're methodical with what they do. It's not just a spa-like setting up there, right, although it is relaxing. And so coming in here, relatively speaking, I'm going to go through just a little bit of an examination for him. This is his exit exam, if you will, for his injury. I'm going to be looking at his range of motion, his strength. I want to see the quality of his movement. We've kind of talked a little bit about a game plan. He's gotten take-home exercises now. He already knows what he's doing in the gym as it is. So we're programming those into his routine so that he can find the time and space and get back with his family, his little one, and the downtime he has now before he gets back and gets after it at work. So let me show you a little bit of that exam, if you will. Vinny, go ahead and stand up for me. And you can face me. I'm looking globally. When he came in, right, his problem area is here, and that's where the majority of the treatment, if not all the treatment, is happening. From a biomechanical standpoint, biomechanical standpoint, I'm going to look at the whole shoulder. So let me see you bring your head back. So I'm going to look at extension in the cervical spine. I want to see if there's any guarding in the shoulder girdle on the right side or even left. I know he had the surgery on his left elbow. Bring your chin down to your chest now for me. But when we were working on him, it's not just in that general area, it's everywhere. And then face me.
This is right elbow.
I know.
Oh, okay.
Yeah.
My bad.
Yeah,
My bad. I'm
appreciate
keeping my bad.
You can sit here for me.
Edits.
Good thing I'm not doing surgery.
I know, right?
There you go. Bring your head back for me. Good. Rotate. Easy. Bring your head back. Rotate. Good. And then bring your chin down. Good. So you can't help but look forward for me, compensate through the initial portion of kind of being in the sling and being resting. So there's a lot of tension that we've been working on in his right shoulder as well. Arms up like this, man. Good. I'm gonna push down here. Hold strong. Don't let me move you. That's rock solid. Arm up. Okay. Hold strong. Pull your wrist to your shoulder. Good. Maintain that. Good. Nice. Hold strong here. So I'm just comparing side to side. I want to see equal strength. Push into my hand here. Hold strong. Good. Push. So this is like working with a professional athlete when it comes to working on somebody like Vinny. Hold strong. Push, 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 push. Maintain. You need to maintain a little bit of that. Okay. Grab my hand here. You can relax that arm. So he has to be not like 50, 60% better, no pain. It's not that. He needs to be able to perform at a high level without any resistance. So hold strong here. I'm going to pull you in. Don't let me. You take your hand and flip it over this way like you're winning an arm wrestling match. Go ahead. Yeah, maintain that. That's really good, Vinny. Good. I'm going to pull you in. Hold strong. So I'm working on supination, pronation with his resistance in those positions. Hold strong. Now pull that thumb open for me, like this. The whole wrist and thumb. Try to rip it the opposite direction. Not that way, other way. Yeah. Hold that. Maintain, maintain, maintain. Good. Any pain with that in the elbow?
Just a slight.
Where do you feel it?
Slight on the turn to the right.
When you open up?
Yeah.
You feel it down here on the joint?
It's like more like here.
Okay. That's a little bit more separate from kind of the tissue we're working on. That's more just this extensor mass. You getting after it in the gym a little bit more?
Mm-hmm.
Heavier weights?
Yes.
So you're going to feel some of that pressure. You can roll out that extensor, those muscles that run from the top of your forearm down.
Okay.
Use a lacrosse ball, get into this tissue right here, pin it, and then stretch it out before you lift, just to give it a little bit of a release, if you will. No pain on the bicep?
No.
All right, cool. Go ahead and stand up for me. I'll show you some of the soft tissue work and management that we use for him. Carly will do a nice job of kind of editing in so you can see what Shockwave looks like. That's really where the majority of our scar tissue management lie on your back for me. Awesome. But yeah, I'm glad you're feeling better, man.
Hey, thanks, man. I appreciate you guys.
Absolutely.
For sure, because you've definitely been a ton of help.
It's been fun. Like for the last, so I've been in practice with my father for 6 years here. We have 7 chiropractors. We got 4 personal trainers. We have 2 massage therapists. We have a big team. So we're able to see just a lot of people, relatively speaking, but give kind of local, small business-like feel care, if you will. And relative to Vinny coming in here, he's not the only firefighter that we're seeing coming into the office. So we see a bunch of guys from Montgomery County, a bunch of guys from Baltimore City, Baltimore County. Obviously, we're out here. We see a lot of local guys. And it's been fun working with that group, because once you kind of take care of one of those guys, they talk, and they're starting to say, hey, it's a good spot to go get taken care of, recover from an injury, or like in Vinny's case, or just get care. Relax. You expecting? I just had mine. Your lovely wife has also kind of been able to use this office.
Yes.
From a pre and postnatal standpoint.
Yep.
Not necessarily from a firefighting standpoint.
Right, and you guys helped her through the first pregnancy, and now we're on our second. So she just left from getting her massage.
With Jess today, he
yes.
gets a little handoff. That's cool, man. 2 going on 6, right?
I'm done. I'm gonna leave the 6 to you, man. Yeah.
And if you're someone who's been through an injury, relatively speaking, at work, you kind of know that there's. I think Vinny did a good job of doing his research. He kind of made a comment about that earlier when he first found us, and I'm not even referring to our office relative to that. I think he knew, he kind of lined it up already with his care after the surgery, but getting the surgery itself. And just know that, like, you got in this state, you have control of where you want to receive the care that you get. So that's available to you. Don't sit back and just let the ride in the system.
Mm-hmm.
Take control of that. Make those decisions for yourself, because you have access to quality care. Towson Ortho is a great place from a surgical standpoint.
Mm-hmm.
They do great work. We refer a lot of business over to them, relatively speaking, a lot of patients. And then vice versa. Bend your elbow. Extend. And so a lot of pin and stretch for him coming in here, doing some mobilization to the bicep tendon. The big thing I want to focus on with him when he's got this kind of reattachment is that there's no scar tissue formation at the tendon, that he's loading in a progressive way. He's recovering well, relatively speaking, to the load that he's putting on his bicep tendon. It's really kind of that 4 to 6 week time range post-op that he's the most susceptible to re-aggravation of the tissue, and he didn't do anything that did that. We maintained some good mobility. We did light therapy on his elbow just to help it heal a little bit faster.
Mm-hmm.
So we were doing class 4 laser. Then we got into remodeling care, where we were getting in and working the tissue,
mm-hmm.
not just letting it settle and be what it was. We wanted to form it the way that it was designed to be, so that when he goes back in there, he's got full range of motion. He can load it. He can do what he's got to do, relatively speaking, of not thinking twice about his arm when he's in an emergency situation. Extend your elbow. Feel traction here.
Mm-hmm.
So overall, like, his exam is very clean. He's been checked out by me. He's been checked out by his ortho. Now he's going to take it to that performance level, if you will, of pushing his body in a gym setting, and really see what his arm is made of before he goes in and puts someone's life in his hands.
Mm-hmm.
So extend. A little more pressure here, then. So weeks 8 through 12, that's when we cut into a little bit more load.
Mm-hmm.
Started doing some elbow-based work, some banded resistance, some exercises for not only his elbow, but like I said, functionally speaking, if you just do only here, you're not ignoring any scapular stability stuff, you're missing half the picture. So making sure that he was in line all the way through. With some of the therapy that he was getting back there, we dry needled him in the beginning as well. He was getting some therapy directly to that tissue. Pain management with the dry needling, pain management with the light therapy, all natural, but all kind of harnessing your body's ability to recover. And then, hey, how do we get away from this happening again in the future? And that's where we go in some progressive eccentric loading on the bicep and some of the pronating muscles of the arm itself, as well as really kind of talking a little bit more about doing some more explosive stuff over the next month, so that he's ready to go. And he's giving himself time to recover in between each session.
Mm-hmm.
And I appreciate getting to work with you during this case too.
No, man, I appreciate you guys, being patient with me and helping me get to where I need to be.
For sure. You gotta lift a lot of babies in the future.
Yeah. No lie.
I'm gonna bring you on up. Okay.
All right.
So that's it for the elbow treatment. All right. He's all set to go. He's had his massage today already, and he's released from care, relatively speaking, for the elbow. And he'll maintain the relationship with us going forward for his body, just in general, his spine, musculoskeletal health. Hey.
Thanks, Mom. Appreciate you, man.
Appreciate you too.
Thank you.
Yeah, absolutely. Thanks for watching Baltimore. If you need any help, got any questions, don't be afraid to put a comment below. Thanks.